So CheckMate 227 is a large study that's been going on for many years now, looking at the optimal treatment for patients in the frontline setting of advanced non-small cell lung cancer. There were two groups. There was the patients who were randomized depending on their PD-L1 status. So in the PD-L1 positive group, patients were randomized to either Nivo-Ipi, Nivo monotherapy or chemotherapy by itself. When we look at the outcome, we see that Nivo-Ipi is superior to chemotherapy, but unfortunately Nivo monotherapy is not superior to chemotherapy. When we look at the Nivo-Ipi group that's superior to chemotherapy, the key question is what proportion of PD-L1 status is driving that benefit? And indeed, when we look at that, we see that the PD-L1 50% plus group is deriving all the benefit. So to me, the interpretation is that this is a reasonable option for those patients. But in real life, those patients are either getting pembrolizumab monotherapy, they may in the future be getting atezolizumab monotherapy, and they're also eligible to receive chemo together with pembrolizumab as triplets. And so therefore one needs to bear in mind the decisions as to which combination to use depending on the adverse event profile, because the hazard ratio for Nivo-Ipi versus chemotherapy was pretty similar to what we see for pembro monotherapy and pretty similar to what we see for pembro chemotherapy. In patients that were PD-L1 negative, patients were randomized in three arms. So in patients that were PD-L1 negative, they were randomized to either chemotherapy, chemo-Nivo, or Nivo-Ipi. And again, in this scenario, chemo-Nivo was not significant, and therefore Nivo-Ipi was the preferred outcome here because that did reach significance. However, this was not a predefined primary or secondary analysis, it was an exploratory analysis. So therefore in the PD-L1 negative population, Nivo-Ipi does represent a potential treatment option alongside chemo-pembro, but for the same sort of hazard ratio that we get in terms of its benefit, one has to consider the potential toxicities that we have to deal with on each individual patient basis.